Hello folks, Dr. Paul here with a video summary for Unit 4. This unit we talked a lot about Carl Whitaker and Virginia Satir, and oftentimes in textbooks and discussions on the history of family therapy, you'll see these two great therapists lumped together. I'm not really sure they belong together, except that they have some similarities in that they are both viewed historically as two of the great clinicians of the. Sometimes you see them listed under the heading of experiential family therapists, and I think to some degree that label fits for them. Probably a bit more so for Virginia Satir, who did a lot of things like family sculpting, and so she was very in the moment with clients, borrowing some techniques, excuse me, from Gestalt psychology, where you're very much in the moment, talk to the empty chair. Satir is viewed as a very influential figure because she was very charismatic, and in many ways, she brought a lot of family therapy ideas to the masses. It's always a very significant thing when something that um, or academic realm is able to be brought to the masses, whether the masses are therapists or of clients. The good news and bad news of that, obviously, the good news is more people were exposed to family therapy because of people like Virginia Satir. But the bad news is that the ideas tend to get watered down. And although she started or spent some time Palo Alto group at the Mental Research Institute California in the late 60s and early 70s. So she was in some ways affiliated with the heart and soul of MFT, with the Bateson Group that also had as part of it Jay Haley, Don Jackson, Paul Watzlawick, John Weakland. They're all heavyweight superstars in the MFT history uh, field. So Satir was part of that group, but when she kind of broke away and went on her own, she took a lot of the family ideas again to the masses of therapists and to people, and a lot of the systems ideas that were so precious to the folks over at MRI, um, rigorous as the rest of the field would have liked to be. I think there's some storied examples of her and Mnuchin getting into some disagreements because, again, she was using a lot of individual pathology based talk in her work. She would talk a lot about self esteem and anxiety and moving toward wholeness. And these were pathological concepts that a lot therapists, even at that time, were starting to move away from individual pathology talk and more of a relational talk. So, again, it was kind of good news, bad news with Virginia Satir. Carl Whitaker, on the other hand, very interesting character, trained as a psychiatrist, classically trained psychiatrist, and stumbled across family therapy almost by accident, as many of the founding fathers. And he was very much a innovator in his clinical work. Um, his approach is kind of an anti-theory because he loosely talks about family structure. He was influenced by Mnuchin, about unbalancing the system. Whitaker is very fond of the idea of using himself and live and growing yourself in therapy as a way of being helpful to people. He did some outrageous things in therapy. There are stories of him purposefully falling asleep in session. For Whitaker, because he worked with a lot of schizophrenics and their families, like many of the early family therapists did, I remember a quote of his saying he always wanted to be the craziest one in the room. And so by putting that label onto him, he was taking it off the identified privilege to meet Carl Whitaker when I was in my master's program at Hofstra University. Visit us for a day and do a workshop toward the end of his life. And very, very smart, very, very comfortable in his shoes, and someone who just knew exactly what he was doing in the therapy room. Um, I think it's important to mention that people like Whitaker, like many of the other founding fathers, again, being trained as a psychiatrist, very immersed in that system, he got kicked out of psychiatry because he was experimenting with seeing families. And I heard of people like Mnuchin and Whitaker. Folks were taking tremendous professional risks by seeing families and um, pushing away ideas of psychoanalysis and individual pathology, doing this very unusual brand of family therapy that, in many ways, Whitaker and Satir are precursors to what we would call strength based therapies, whether it's solution focused or narrative or collaborative. Um, I don't think they qualify to be strength based, even though they were certainly precursors in that they were looking at people in terms of a system, and reorganizing that system meant the reorganization of the individual family members. Um, but I think because of the pathologizing language in both Whitaker's and Satir's approach, we kind of have to see them as still in the pathology camp, in the deficit model camp. Um, Certainly, it would have been a difficult for us to have evolved as the field has toward strength-based approaches like solution-focused and narrative therapies, for example, weren't for the influential people like Carl. If you have an opportunity to view videotapes of their, the AAMFT has videotapes of them, and do a live session. They talk about their work. Love this quote by Carl Whitaker. I don't ask what do I need to do in therapy, but rather, can I be alive enough to help them grow? Therapy, um, if you think about your intention as you're sitting with a client, so often it's what do I need to do? What do I need to fix? What do I need to change? What's going on that I need to fix? But the idea that it's not so much about what we do, but who we are, and from doing, because so much of the doing in therapy is what contributes to the problem. Remember, the problem becomes the problem. Well, in therapy, many of our solutions to problems of putting forth how do you be different in therapy and not doing something that usually comes from our own, what we think needs to happen in our role as a therapist. And sometimes from the last unit, I just wanted to touch a little bit about paradoxical intervention. I think they're very misunderstood, from the idea that it's simply reverse psychology to something new. Um, in many ways, the term or the phrase paradoxical interventions was first order cybernetic ideas, early family therapists, where it made little logical sense to restrain people or to prescribe the symptom. Refrain, and prescribe was the formula. Reframe the context, and then refrain people from changing their behavior and actually prescribe more of their behavior. Well, that is paradoxical from the standpoint that people are coming to therapy to change. And when a therapist shifts their perspective and encourages them to keep doing their symptomatic behavior, that's paradoxical. With a bit of a deeper understanding, though, I think it's easy to see how any attempts to refrain people's sense of their current behavior and even to prescribe it is not very paradoxical at all. If we believe that systems operate for reasons just about getting rid of um, disorder, or if it's just about getting rid of the phobia, or if it's just about substance use, or whatever pathology that we tend to use in therapy, if it's just about getting rid of it, then I think we're missing a lot. There are bigger purposes to so called psychiatric symptoms. There are bigger challenges that they present. Overcoming them means so much more to them on so many other levels beyond just simply. So, I prescribe symptoms all the time. I make sense of so called crazy behavior or psychiatric labels. Um, and prescribe them not for the sake of being a technique. So if I prescribe the behavior, then they'll change it. That's not necessarily connect and pace with and prescribe um, something that's already happening. It can become a very meaningful experience for people, space between them and their problem, that gives them more choice about whether they want to continue that behavior or if they want to experiment with something. Lots to say about paradoxical interventions. They're very challenging to wrap your brain around, and I would encourage you if you're interested, and I think you should be because they're very powerful ways of doing therapy. Paradox and counter paradox, the classic family therapy text on team. Polo and G. Luana. Certainly, the tactics have changed by the mental research. Fish and Siegel, anything by Paul Watzlawick. You'll get a heavy dose. Jay Haley, Problem Solving Therapy is another great text. So, okay, and let's see. Just some reminders. For all assignments, read the scoring guide and be sure to include everything in each assignment when you look at the scoring guide. Oftentimes, it includes explicitly stated in the assignment itself. So, to be on the safe side, read those. Please be mindful of due dates for discussion postings as well as assignments. And every couple of units, I update the grade book with the discussion grades. So you can find those there, as well as any assignments that we're doing. Okay, folks, I hope you found this summary helpful. After you view it, if you would just uh, repost or respond that you viewed the unit summary, this unit, and one thing that sparked in you some additional thought or additional questions or additional thinking. Okay, great.